This is Jason Profetto. This is the chair for clinical skills. I am going to be doing the clinical skills preceptor orientation for our second medical foundation, which is MF2. So if you are viewing or listening to this presentation, you're here because you have been selected as a resident preceptor for clinical skills and McMaster for MF2. So we'll get going through it. This should take about 20 minutes or thereabouts, and I'm going to show you the presentation and the guide. So, just a bit of an overview of McMaster. McMaster's medical program is a 3-year program, and it's broken up into both pre-clerkship and clerkship. Pre-clerkship is everything that's before the major mandatory clinical rotations, and pre-clerkship is broken up into essentially 6 parts. So there's medical foundations 1, 2, 3, and 4. And then there's a post-medical foundation for elective opportunity, and that's essentially the summer. And then there's going to be the integration foundation, which is done at around September to November of the following year. So what we are actually going to be doing is focusing on Medical Foundation 2, and that is the second medical foundation in the pre-clerkship part. Pre-clerkship itself is broken down into a few mandatory components. So you'll see that there's tutorials, professional competencies, clinical skills, and there's essentially the 5 medical foundations plus the post-MF4 clinical elective experience. So the tutorials, the professional competencies, and clinical skills are the 3 major mandatory parts of the pre-clerkship. Tutorials are generally twice per week, so it's usually a Monday, Thursday, or Tuesday, Friday combination. Tutorials is where a lot of the academic content is taught, and this is in a small group setting. Professional competencies is a longitudinal curriculum that goes right from the start to end of pre-clerkship. It is every Tuesday morning between 9 and 12, and professional competency focuses on more the professionalism, ethics, and even some of the global health, clinical decision making, and different topics in and around those pieces. And then clinical skills, and this is an important thing, is that clinical skills is really a focus on the teaching and practicing of histories and physical examinations with an introduction to the diagnostic thought process, right? So clinical skills, in contrast to tutorials, is only once per week, and it's a 2 to 3 hour session, and that is exactly what you guys that are listening and viewing this video are going to be doing. So here's another small breakdown, and it's just good to get a sense of what the students are going to be doing from week to week, because you're going to be teaching clinical skills. Clinical skills and tutorials are going to be small groups that are the same. So the tutorial group is also the clinical skills group, and this switches every MF. In contrast to ProComp, professional competencies is one group, it's 10 students, so a little bit larger than the other groups, and this will be longitudinal, so it'll be the same group for the entire pre-clerkship. So tutorials and clinical skills have the same group, and you'll see there that the tutorials are taught or facilitated by a tutor. The ProComp has 2 what we call LFs, or longitudinal facilitators, and then clinical skills is taught by co-resident preceptors. So each of these 3 mandatory components all have different teachers and facilitators. Clinical skills and tutorials are the same group and will change from MF to MF. Clinical skills itself is really a focus on not only teaching but the practicing of histories and physical examinations, right? We do an introduction to what we call diagnostic testing and medical decision making or clinical decision making. It's so that students understand they're asking questions, they're learning how to ask questions, they're learning how to do physical examinations, and then they start to apply what they're thinking in a very rudimentary way. So I highlight the words history and physical because it is extremely important that we focus on these 2 parts of medical curricula in this part of the pre-clerkship clinical skills. Clinical skills, generally speaking, is a weekly session. So there's 1 session per week for the entire Medical Foundation 2, which is approximately 8 to 9 weeks. Each session is 2 to 3 hours in length, right? And generally what happens is that, we'll talk about scheduling in a second, but you have a clinical skills manual, there's objectives and an agenda for each session, It's designed in a very particular way so that every group across the entire medical school, including the 2 campuses, is doing somewhat of the same thing to ensure there's a baseline consistency. Each group will be made up of approximately 7 to 8 students, and there will be 2 resident co-preceptors per group. And again, the focus is on teaching the history and physical exam and also practicing it. In terms of where you will be doing clinical skills, there's a few different options. There is the CSBL, which is the Center for Simulation-Based Learning at McMaster Hospital. There's 1M and 1G. These are just the different locations. They are on either side of the cafeteria. So 1G is very close to the cafeteria, whereas 1M is much closer to the anatomy lab, and you can find them in the frequently asked questions and information pamphlets we hand out. You can use that space, the CSBL. It is literally designed for teaching clinical skills. So there's a bunch of clinical skills rooms with, different types of one-way mirrors, equipment, beds, etc. And you can book that space during the day or even in the evening. You can actually use any Hamilton or McMaster-based hospital. So if you are working on the ward or doing a rotation, or part of your residency is you're running a clinic or something in different parts of the hospital, you can use the space in the hospital as long as you have permission from administration or your clinical supervisors to use that space. That can be like the emergency department. It can be rooms or examination rooms on a ward, or teaching rooms on a ward, or any of the hospitals. And if you're doing family medicine or outpatient clinics or pediatrics or whatever, you can also use community clinic space as well. And again, as long as it's within a reasonable geographic distance from the hospital, the students can get there, and you have permission from the individuals that are responsible for those clinic spaces. We like to teach in a real hands-on way, which means that we should really be using patients to speak to and practice on. There's a few different options. The standardized patients, so there's such thing as SPs. We have an SP program that's not specific to medicine, but for the Faculty of Health Sciences at McMaster. And you are allotted 8 hours of standardized patients per MF. So that means you can book standardized patients through the SP program for a total of up to 8 hours for this medical foundation. Standardized patients can come in different ways. So you can ask for specific history type stations. You can ask for certain physical requirements, like if you want to do a respiratory exam, you can tell them you want to do a respiratory exam. And there's different levels of diversity that are available through the SP program as well, and you can speak to them about the specifics of that. But there are SPs that you're able to book, and you'll have all the information on how to do that as well. You can also use real patients on a ward or in the clinic, depending on where you are. And then I'm just going to jump from student colleagues to a second to St. Peter's Hospital. St. Peter's Hospital is a long-term continuing complex care hospital associated with the Hamilton Health Sciences that has an administrative person that vets the families, the patients, chooses patients that are appropriate for teaching and academic involvement, and obtains their consent and permission. So you can book real patients through St. Peter's Hospital, the standardized patient program, or you can ask real patients on a ward or a clinic. At all times, I think it's very, very important to ensure that you have consent and permission from anyone that you're going to be using in an academic or teaching way. Our experience has been the vast majority of patients actually really do enjoy participating in teaching, and they're very willing to do so. Please use your discretion and do what's appropriate. So if you think someone's too sick to participate, err on the side of caution. If you get someone that's fairly enthusiastic and the family is very supportive, then I think that's much more appropriate. And of course, we can always use student colleagues. That means we can practice amongst each other. There's a little bit of complexity here in that we don't have a formal policy of what you can and cannot do with student colleagues. Generally, we advise caution and discretion, which has been essentially a safe plan for our clinical skills teaching. But that means it's probably not appropriate to do an abdominal exam on a colleague if we're talking about removing a shirt or draping, that sort of thing. But if we wanted to practice blood pressure, a peripheral vascular exam using the legs and feet, doing a cardiac exam or a respiratory exam or a head and neck exam, I think that's much more appropriate. So at any time, like, this is really an opt-in, not opt-out system. It's not an expectation of any of the students. Never force or coerce anyone to do this, and just ensure that the teaching environment is as welcoming and safe as possible. The clinical skills manual is something that both the students and the preceptors will have. This manual will have all of the information in terms of the agenda, the objectives, what you need to get done by the end of the medical foundation in each session. And that is what we ask you use in terms of organizing your sessions and content to be taught. This document has gone through multiple iterations and has been developed and revised over many years, and there's been input and editors from varying backgrounds and degrees. So there's a lot of effort that has gone into this document, and we encourage everybody to use it. There is also something called the AFMC Clinical Skills National Working Document, which is a Canadian-wide thing that all the chairs of clinical skills have gone together and decided upon over the last 10 to 20 years in terms of like what are the standards for how we teach and what we expect our students to perform. So this is referenced in the clinical skills guide or the manual. If you're ever curious as to what a student should know or should be doing for their level of training with any specific clinical skill. And the last thing here, which is a big thing, is that we've really worked hard in the last 3 years to make our clinical skills guide as integrative as possible with concepts around diversity and inclusion. So we have done some research and quality improvement work over time to identify areas of diversity that we thought were lacking in clinical skills. Some big ones were, for example, individuals of different color or skin tones or backgrounds, that certain parts of the clinical exam should be altered, or we should be cognizant of the different changes. So an example would be the different presentations of something like melanoma on an individual that has a fair complexion with a British or Scottish or Irish background, compared to how you would detect melanoma on an individual that is black and has Afro-Caribbean descent. Or say, for example, someone that's from Ghana and their skin tone might be a lot darker than someone that is from England, for example, and how we take into consideration those differences and how we teach them. Another big one has been LGBTQ plus populations that may have some things to take into consideration, especially around the trans population. So we've worked hard with our allies and resources that have a lot of information and expertise in trans-sensitive health, and we've included these into the working document. So if there's any population that may require some focus or changes within their clinical examination, that is actually included in the document as well. So we hope that you use that to make it as inclusive as possible. And diversity is a very normal thing, but it does exist. There's definitely a variation amongst the population in many different ways. So the clinical skills manual, I think that's my cue to show you this manual. Is it here? There we are. So this is the clinical skills manual, and you see this is for MF2. We're doing them MF by MF right now, and the main reason is because the new curriculum, we're still updating MF3 and MF4, whereas in the past we had done all the MFs and we had given one large guide. But nonetheless, this is the clinical skills document, so there's a bunch of preamble at the beginning, there's a list of all our authors and editors, and then this is the table of contents. So you'll see two things here. There's the MF2 clinical skills overview, and this is the actual content that's going to be taught. So in MF2, for this new curriculum, we're going to be looking at the volume status exam, the renal examination, the lymph node examination, and then we're going to cycle back to the cardiac hematological exams, as well as the peripheral vascular examination as well, right? And you'll see that these come from the MF1 guide because we're going to be circling back to content that's been taught. So this is the content that more or less is going to be covered. Each of these is actually its own section, as you may know. So when you go to volume status, focus history, you'll see that there's a whole history on how to do a volume status with different things, and hypovolemia, and all aspects of it, pertinent notes about the physical examination. And there's different little things here about, like what you would do on an OSCE or why certain things are important to check. Here, as I go down, just for an example, you see this highlighted orange area, which is an indication that we've looked at some things around diversity. So modification for patients with obesity. And just, talking about some of the different ways that you can look at pulses in individuals that have different body habitus. And then if you go down, there's some cool things around sensitivity, specificity, and likelihood ratios as you look at different examination techniques. And this is all from the Rational Clinical Exam series, the JAMA series. So it's all there in the actual content. And you see the renal examination as well. If you go back to that page, these are the different content areas. And then this is the session guides, right? So it'll tell you session 1, 2, 3, all the way down to 8. So there's 8 weeks here. And it'll show you exactly what's used and done on every single case, right? So if we go to session 1, so this is Medical Foundation 2 weekly session guide. Global objectives and an actual agenda. You'll see there's things around practice and feedback. There's the direct observation clinical skills. So if you ever need a checklist or you want to do some direct observation with students, or students want to do it with each other, they have that sort of guidance. And as you go down, there's different cases that you can use to practice, and you can make that into like a standardized case or standardized patient. You can do it with students. You can find people that would substitute for this on the actual ward in the clinic. And you'll see like there's different pro-comp objectives or things that would relate to clinical skills where we tie and integrate them together, right? And my email there. So as you go down further, you'll see that there's, the different schedule and all the different things that need to be included week to week. We would encourage you to just follow this guide the best you can and to ensure that it's being done in an organized way and that students are aware of all the different sessions that you're doing as well. Sorry. So if we go back to, here we are. So the clinical skills overview, and we're just rounding off, we're not too far away. So evaluations, there's going to be both a mid and end of unit evaluation. It's very, very important that a mid and end of unit evaluation is a time where you give students feedback about how they've been doing to date, but this should never be a surprise. So you should be giving students feedback on a regular basis, week to week, direct observation between yourself and or your colleague. The process is that we use MEDSIS, MEDSIS, other schools use it as well. One of the 2 preceptors will receive an email at the midway point, and then again at the final weeks going to a close. It's very important that you do these evaluations through MEDSIS. These are the formal ones that need to be documented as soon as possible, as soon as they become available, because the final evaluation for their MF2 will not be able to be completed until this is actually completed for the evaluations with clinical skills. And again, there should be weekly direct observation in the clinical skills sessions, and feedback as much as possible should be often and specific to what students are doing. Professionalism is a big thing. I won't spend too much time here, but I think as long as they're dressing in a reasonable business business casual attire, they conduct themselves in a professional way. And, the things we say, the language you use, and the interpersonal dynamics are very, very important, especially as we model this with the patients that we're interacting with, and so that students can see this. But these are all, I think, pretty reasonable and fair standards. And if there's ever a concern around this, please let me know. So in clinical skills, as you know, it's a week-to-week thing. Our residents, you guys, are our teachers. There's definitely some weekly variability in that. There's call schedules and people have things that come up. So do whatever you can to make it as consistent as possible. But of course, these things are never ironed out perfectly, and they can change from week to week depending on what's going on. Generally speaking, we do a weekday, Monday to Friday, and it's usually in the late afternoon or evening. Much less often we'll do weekends, like a Saturday or Sunday clinical skills teaching session. But if that's like the only option you have left and it works with the group, that's okay too. These are definitely mandatory sessions. The rule is that students are not allowed to miss more than 10% which works out to only one session missed per MF. And then beyond that, they'll have to enter a remediation plan. Make sure that students are as flexible as possible, because residents are working around, you guys are working around call schedules and such. And students have to understand that this is a mandatory part of the curriculum, and they really should not be missing it for things like conferences or interest groups or recreational activities. There's going to be an FAQ sheet that's circulated with this video and some of the details around clinical skills. And it'll have all the information about who to contact for bookings in the CSBL or the standardized patients, and how to book patients at St. Peter's Hospital. And there's a bunch of other detailed things around like stipends and scheduling, professionalism, evaluations, all sorts of things. So it's a very helpful info sheet to have. Now, I'm going to end there, but I just want to say a couple of things that students love clinical skills. It's by far, it's rated one of our most enjoyable parts of the curriculum, where students get to be as close as possible to what real doctors do, right? And residents generally really love teaching clinical skills, and we always thank residents who are interested in teaching, because it requires time and effort, and it's generally a very enjoyable thing. Role modeling and mentorship as a result is a significant part of this process. Students often remember their clinical skills teachers quite a bit, and they sort of embody the role model that the clinical skills teacher is. Whatever you do too, like, enjoy it, have fun. You're teaching. These are students that are keen and they want to learn, and it's still early, it's MF2. Be creative, have fun. You can do all sorts of different things in clinical skills, but just make sure you stick to the clinical skills guide. And at any point, if you have any questions or need anything, just shoot me an email or call me or speak to our staff, our administrative staff, and we'd be happy to help. On that note, thank you very much. I'll end it there, and I think that keeps it in good time. And then if you need anything, just let me know. Best of luck. Thanks.